Central Ohio Urology Surgery Center is located in Gahanna, Ohio. We're comprised of 27 urologists and do over 9,000 cases a year in urology. There was 11 other physicians on the other side of town that had not yet joined. They joined into the practice and with that brought over a significant number of increased cases, increased case volume. So for us, it was imperative that we were able to have the efficiencies to be able to see our patients in a timely fashion and service our physicians in a timely fashion as well.
EndoSheath is the part of a system that allows standard flexible cystoscopy to be done in a much more rapid, efficient manner, such that you don't have to subject this entire flexible cystoscope to the rigors of sterilization.
In the old traditional way of processing instrumentation, we would have had to soak the scopes in a high-level disinfectant solution for 20 minutes, and then you have to triple wash them to make sure that the disinfectant is actually off of the scope prior to using that.
So it was kind of a long process. It took half hour maybe total, including the 20 minutes of time that had to sit in the solution itself. What changed when we started using EndoSheaths? It became a lot faster. We were able to see more patients in a day, and I think the patient care was better because we weren't wasting 5–10 minutes trying to get the scopes reprocessed.
Our scheduling has actually become much easier. Prior to utilizing the sheath, we had to sit down and map out the day just to make sure that we didn't have too many of those back to back. I can bring those patients in, and instead of doing 10 a day, I could do 20 a day. So therefore, the economic benefit is actually being able to do the cases because we have the timely turnarounds.
EndoSheaths make my job easier because I don't have to go get a scope that's in the room already. I can have the room ready in 3 minutes and have the patient in another minute. It's a lot easier to clean because we just use an enzymatic cleaner, rinse it off, wipe it off with alcohol, and we're ready to go again. So in the traditional way of cleaning the scope is about over 20 steps, and with the sheaths we were able to cut it down to 2 or 3 steps. So it made everything a lot faster. Before we were in the chemicals quite a bit, quite often. Now we don't have to worry about it.
So from an infection control standpoint, the sheath gives me a whole lot more comfort knowing that I'm providing the level of quality of service to the patient.
With the EndoSheath, there's no sitting. It is just a continuous flow, and it allows the entire patient experience to be seamless. It removes impediments to getting through your day at a reasonable rate. There are no broken scopes, there are no waiting for scopes. So from that, in a day when you know there are going to be things that slow you down, that go wrong, it's nice that these don't have that issue. They work all the time, and you can use them and rely on the fact that they're ready when you are.
From a large urology group practice perspective, the things that we've actually been able to gain from using the product, the sheaths, are efficiencies and volume and safety and assurance that we're following infection control. I think those are the things that are really important for anyone who has a high volume practice to consider.